ago, now I'm paying like $2,900 a month, $3,100 a month. Prices are really becoming ridiculous. I know it's hitting my family. Chances are it's hitting your family too, and the families of everyone you know. The state should control the costs. Our healthcare premiums, they're not increasing due to market forces. In fact, we could be controlling the cost of healthcare because in Maryland, the state controls prices, especially in the hospitals. And we matter. We can do something about this. In Bethesda, we're the most well-educated and one of the most powerful constituencies in the state of Maryland. We're the main source of tax revenue for the state of Maryland, and if we send somebody to Annapolis to demand change and saying we've had enough with rising health insurance premiums, they're gonna listen to us. But we need to send somebody to make sure our voices are heard. Now, I've worked at Johns Hopkins. I've worked at Kaiser Permanente. I've worked at DC Medicaid. I've even spent 2 years working on health policy in the Maryland House of Delegates as a staffer. And I have a master's in health policy from the Johns Hopkins Bloomberg School of Public Health. I'm the sort of expert, if you send me to Annapolis, I'll work and I'll cut your health insurance premiums in half. It's something we can do. I'll work to create the opportunity to cut our health insurance premiums in half. And healthcare is complicated, I know. But complicated or not, at the end of the day, we're being stuck with an ever-increasing bill. And the crazy thing is, we can cut it in half. There's no need to continue overpaying for our health insurance premiums. We pay for everyone's ER visits. Every time an uninsured individual comes to the ER in Baltimore City, and let me tell you, there were 1.8 million ER visits in the state of Maryland last year. The state raises the prices in the hospitals for everyone. Accordingly, large payers like Blue Cross Blue Shield increases the premiums, which hit the pocketbooks of beneficiaries in Bethesda. So let me just reiterate that to be clear. Every person in Bethesda is seeing rising health insurance premium costs as a direct result of our 700,000 uninsured individuals going to the ER 1.8 million times every year. Unacceptable. We're paying for whether we like it or not. So guess how much these hospitals and health insurance companies are paying in corporate income taxes? Because surely they're making a lot of money off us. That's right, they're paying zero. They're paying nothing in corporate income taxes. They're tax exempt for providing care to the uninsured, when in turn they use that same excuse to increase the prices on our premiums, on your premiums. So what sort of solutions do we have? We've already been paying for the uninsured through the emergency room in the most inefficient and expensive way possible. We need to cover our uninsured through a public option by requiring 500,000 public employees to get that public option, to get a basic health care plan in a large risk pool. It will use to gain economies of scale and negotiate down drug and medical device prices. We need to expand our price setting authority in Maryland from just a hospital setting to the physician's clinic, the office you go when you go to see the doctor. And we need to think about whether our hospitals and health insurance companies that compensate their executives in the millions of dollars with salaries. I'm telling you, the CareFirst CEO makes about $3 million a year in salary, if they really need to be exempt from corporate income taxes. No one is talking about this, and we're taking it in our pocketbooks. Not our governor, not our legislators. Nobody's talking about the rise of increase of health insurance premiums. And by the way, just so you know, 1 in 3 of our delegates and senators in the state legislature, they haven't even been elected. They're appointed. So it's no wonder they're not accountable to us, and that's only perpetuating the problem. We need to make our voices heard. We need to do it this election, and we need to do it with my campaign. Send me to the House, I'll cut our health insurance premiums in half, really do something that takes it home and benefits you. Thank you for having me today.